So we're coming now to work on the sacrum. The sacrum, remember, is that triangular shaped bone at the bottom of the spine. You can see here we're just working on the main area of the sacrum. We're not coming down into the intergluteal cleft. We're stopping before we get to that. I'm showing you this with the client undraped, but I would normally work this with the client draped. Now the sacrum you will feel. If you just feel around on the client's back, I can feel the spine coming through here. If I'm too high up, this is just very soft. When I come down onto the sacrum, you can feel the bone underneath your fingers. So we're working this area of the sacrum. Different people have different size sacrums. You may find you've got a client whose sacrum is just here. It's just tiny. Other people will have broader sacrums. It's just individual bone structure. What we're looking to do is to get a free movement of the surface layers of skin and fascia and muscle. We want free movement of that over the sacrum. We're avoiding working directly on the spine. You can use one hand, you can use two hands. I prefer to do this through a drape. It's just a little more professional, I find. And because I mainly work in a cold climate, it's best to keep as much of the client covered as we can. We happen to be filming in one of the about 3 weeks of the British summer. So you can see I'm just continuing those little circles round, just really moving the skin and the surface structures. You'll feel then, when you come to the end of the sacrum, you'll feel that roll off and then you're into the buttock. What we really want to do is to check that this is free. The easiest way to do this is with the flat of an elbow. You're not using the point, it's just the flat. Note my hand is nowhere near the client's buttock, just be careful of your own positioning. I'm starting on the sacrum and I am simply rolling off the edge. It's not a big movement, it's not a particularly deep movement. It's just ensuring that when you come to do the deeper work now, when we come to do that deep hip work next, I'll show you with knuckles at this side so that I'm not leaning over the client. Again, I would normally just come around the other side. Now, this is what you would do just for appendicular sciatica. If it was axial sciatica, we don't want to do anything that might impinge on this lower spine. So the very most you would be doing would be very gentle circles around. You wouldn't do the roll off, you wouldn't be getting any depth. It would just be very gentle. All of these muscles here with axial sciatica will be protecting the spine. So you might be able to release it and give a little bit of temporary relief, but the muscles will simply come back round and they're doing what they're meant to do. They're protecting the spine. So for axial, just very gentle. For appendicular, you can get in more and you can use your elbow for that roll off at the side. Now this next section that we're moving to, the side work, is only for appendicular sciatica. It's not for the axial sciatica.